It is possible to get COVID-19 twice within 1 month. Though it is unlikely, it is possible that a person can be reinfected with the virus after recovering from it. This would likely be due to unknowingly contracting a related, but different strain of the virus more than once. It is advised that anyone who has tested positive for COVID-19 should take precautionary steps to avoid reinfection, such as frequent hand washing and avoiding close contact with others. Those who have had the virus are still expected to wear masks and practice social distancing when in public, as it is unknown how many times a person can get the virus. Reinfection cases of COVID-19 are still rare, but proper precautionary steps should always be taken to prevent further infection. Regular hand washing and avoiding contact with potentially infected people is critical, especially for those who had a prior infection. Even when taking precautionary steps, it is possible for a person to get COVID-19 twice within a month. It is important to be aware that if symptoms arise shortly after a previous infection, an additional COVID-19 test should be done. The best way to avoid being reinfected is to take as many precautions as possible and be careful of your activities. Making sure to maintain at least 6 feet between yourself and others, washing your hands and wearing a face covering should reduce your risk of a second infection. It is also important to note that reinfections are more likely to occur if the person was only recently infected and was not able to generate an adequate immune response against the virus. It is entirely possible to get COVID-19 twice within a month, but it is still a rarity. Research continues to show that in general, the immune system can develop enough antibodies to protect against reinfections. When adequate antibodies are produced, it is possible for a person to be reinfected with a different strain of the virus. Individuals who have had the virus should be diligent in preventing reinfection, as a second time contracting the virus could be more dangerous. Following recommended practices, such as social distancing, frequent hand washing and wearing masks should reduce the chances of reinfection. In some cases, a person may be reinfected with COVID-19 more than once in a month's time, though this is quite rare. It is possible that a person can be reinfected by a related strain of the virus, which may not have been detected in a previous test. Due to the virus's ability to mutate, additional cases of reinfections are likely to occur. As such, it is important to be aware that contracting the virus more than once is possible. If symptoms arise after a period of having tested positive, an additional test should be taken to confirm that a new strain of COVID-19 wasn't contracted. While it is not typical, it is still possible to contract the virus twice within a month. People who had COVID-19 should take all necessary steps to avoid being reinfected, such as wearing face coverings while out in public and avoiding close contact with others. Knowing the risks of experiencing another bout of COVID-19 symptoms should motivate those who experienced the virus to take all necessary precautions to avoid a new infection. If a person does experience symptoms of the virus, a medical professional should be consulted to determine the best course of action.